Question. Multiple choice. In practicing safer sex, which of the following do you not need to wear a condom? A. Anal sex. B. Oral sex. C. Sliding into the DMs. Or D. Sex toys between partners. The answer is C. Sliding into the DMs. Hi, I'm Samantha Bitty, sexual health and consent educator, and in this episode of Sexy Sexual Health Education, we're going to be talking about safer sex. In order to talk about safer sex, first we might benefit from having a little clarity around what sex is. And the answer is kind of simple, kind of complicated, but essentially sex is any sexual activity. Sex is whatever you say it is, and that could be sex that is oral, it could be digital, it could be penetrative or rubbing of genitals together, it could be erotic massage. And given that definition, safer sex is about a lot of different types of decision making. Oftentimes when we're thinking about, talking about safer sex, we're imagining things like the choices we make around preventing the transmission of STIs, around preventing pregnancy. I want to offer as well in this video that practicing safer sex is also about caring for and honoring our emotional well-being and the emotional well-being of our partners, which of course includes strengthening our conversational skills around consent. You may have noticed I'm using the language of safer sex versus safe sex. The reason for that is because much like many other activities that we choose to participate in life, there are risks that can be managed, negotiated, sometimes even avoided altogether, but we can never truly be in control of every single variable. Just think about riding a bike. You can wear a helmet, you can use the bike lane, you can do the signal things, but we can't always control what's happening in our environment. The best thing we can do is to equip ourselves and prepare ourselves to be responsive when those things come up and make the best decisions that we can. That is, of course, if you make the choice to participate in sexual activity. You may choose not to participate in sexual activity with others or even with yourself. And even then, I would still argue that we have to do the work to take care of our emotional well-being as it relates to our sexual health. Safe-ist sex? All right, we want to practice safer sex. Let's start with preventing the transmission of STIs. The first thing we can do is to educate ourselves. Educating yourself can come in many forms. It can be talking to healthcare providers that specialize in sexual health, checking out the sexual health office at your school. You can find resources online that have sound information. Either way, you want to reflect on the types of sex that you want to have or that you want to be having or that you're already having, and find education about what it looks like to prevent transmission of STIs with that type of sex. When we talk about the physiological aspects of safer sex and the prevention of STI transmission, we can use barrier methods. When I say barrier methods, I'm talking about the tools we can use that go between us and our partners, whether that is between genitals to genitals or it is preventing the transmission of our fluids, particularly sexual ones. Vaginal, anal, sperm, semen, saliva can also be a vessel for STI infections. There's many different barrier methods we can use, and again, it just depends on the type of sex you're having. Barrier methods are so exciting because there are quite a few different ones that can be used. We have got external condoms, which come in latex as well as non-latex materials. They also come in all different shapes and sizes, widths, lengths. lubricated, non-lubricated. I invite you to look into all different kinds and try out what works for you if that's the type of barrier method that makes sense for you. There are internal condoms, which are made from nitrile, which is a latex alternative material. There are dental dams, which is like a sheet of latex that gets used for oral sex, and you can also make dental dams out of external condoms. You can even use non-microwavable saran wrap, because it doesn't have pores, for different types of oral sex. There's gloves, there's finger cots. I love choices, so I think barrier methods are pretty fun. Another way of helping to prevent the transmission of STIs is by getting tested, and different STIs have different types of tests. Testing can happen through swabs, urine, blood, and of course there are things called a testing window, which is the amount of time between a potential exposure and an accurate test result. So you want to be going back to that first step of educating yourself and knowing when is an effective time to be tested. In order to be tested effectively, you want to make sure that you're communicating with your healthcare provider the types of sex you're having. Because our healthcare system can be quite heteronormative or assuming, particularly of young people, based on their gender, the types of sex they might be having. If you're only having like anal sex, you don't necessarily need to do a throat swab to test for chlamydia. So let your healthcare provider know. It's not uncommon to feel anxious or embarrassed or fearful of judgment from a healthcare provider. So look into your options around non-judgmental, youth-positive healthcare access. And if you still feel really nervous or you live in an area that doesn't have a lot of sexual healthcare access, ask a friend to come with you, build that community of support around you, because ultimately you're taking steps to take care of yourself as well as your partners, and that is dope. And lastly, communication. Communication with your healthcare provider, as I just said, communication with partners about your STI status or your testing status, as well as communication with your own body. Knowing what's normal for your body is going to help you to know when it might be time to get a little checkup. Part of the reason I use the language of practicing safer sex is because it's just that. It's a practice. The first time you tell someone, hey, I've been tested and I'm negative or positive for this STI, how about you? It might be a little clunky or uncomfortable or awkward, or finding the right timing might be weird, but the more you do it, the more normal it becomes, and the more you can just like breeze through it and have a really nice time. Being prepared is also going to make that flow a lot easier. If you've got the condoms handy or the dental dams, it's like, oop, it's right here. And you have that little chat and you move into the motions of getting the safer sex method. Sometimes folks can be resistant to using things like condoms because it doesn't feel as good, or oh, it's like an extra, it's in the way. In that case, I invite you to masturbate or self-pleasure using barrier methods. Not only do you get super handy and quick at using them, but you start to associate what pleasure is like with those methods. A last little note about preventing STIs. I encourage you to work on dismantling STI stigma and understanding that STIs are part of sex, and sex, if it's part of your life, might mean that STIs are part of your life. Perhaps you made a decision in the heat of the moment, didn't do the safer sex negotiation the way you had originally planned. By educating yourself, you're going to know what the next steps that you can take are, and ultimately take care of yourself and your partners. Next, we have birth control, the prevention of pregnancy.